Good morning. Welcome to Secret Learners, the space for out-of-school learning opportunity. The previous episode, I promised us a tour within the operating theatre suite. A patient of mine once described her best sleep as the sleep she had under anesthesia. So, fasten your seatbelt, get ready as we take off on this tour within our sleep factory. I know a lot of questions will come out during this tour and some thoughts will need clarifying. Please do stay in touch on our Facebook page, Instagram page, and YouTube channel. And I promise next episode I'll be clarifying these thoughts. So let's go. So this is me on a typical working day. I've just arrived in the anesthetic room and I'm going to take you on a tour of the anesthetic room. This is the anesthetic room where you will first arrive on the morning of your surgery. This is the room where we induce anesthesia, and I'm just going to look closely at some of the things we've got in here. So we have our syringes and our tubings for setting up the drip. We have the sink. We do a lot of sterile procedures, and this is the scrub up area. We have some of our equipment here. This is the infusion pump. We have breathing tubing. We have the blood pressure cuff in there. And then this is our drug cupboard where we have some of our medications. You can see there's a variety of them that we use during anesthetics. That's the bin. This is our airway trolley. It's already prepared. We have our endotracheal tubes, the laryngoscope. We have our airway devices as well. That is my anesthetic nurse who has just prepared the things I'll be using for my first patient. So you can see some of the drugs I've already drawn up. That's the milk of anesthesia, the induction agents I'll be using. We have the cannula, the dressings for setting up the drip. I've also drawn up some emergency drugs. This is the anesthetic machine. It has a ventilator built into it. Okay. This is the vaporizer that has the anesthetic agent that keeps you asleep. And this is the breathing circuit. Right. And so this is a monitor. It's not on yet, but when we connect you up, your vital parameters will show up on this screen. We have the suction tubing. Okay. So this is a brief tour of the anesthetic room. When we've induced anesthesia, we will then wheel you through this other door into the operating room. You can see this is a lot more equipped. It can be daunting really when all the staff are in. We usually have about 8 staff here. We have some other equipment. That is the ultrasound scan that we use for doing some of our regional anesthesia. And that is the bear hugger machine. We use that to keep you warm because it can get cold in here sometimes. Well, these are some of the cables that connect you up to the monitor. There's no patient on yet. When the patient is on, I will show you the screen that has all the parameters. And this is the operating table. Okay? We have a workstation in the operating room as well. So this is the breathing tube with the face mask connected. This connects you up to the ventilator, and that is the ventilator already set up for my next patient who is about to arrive. ECG dots, so we have running ECG while you're asleep, and then that's the blood pressure cuff. You keep measuring your blood pressure every 5 to 10 minutes while you're asleep. So this is me ready for the patient. I'm all done because this is COVID era. The patient is not COVID, but we have to take precautions.
is a nice and hot message saying in the patient. So tie that, please. You can gently put that down as long as it's safe.
No, I don't see.